Welcome to the lecture. From this lecture, we are going to talk about multimodal analgesia. These are our learning outcomes. We are going to talk about each in details. Let's move into the lecture. Pain is a complex sensory and emotional experience. It is a sensation just like pressure, touch or hearing. Even though it's a protective mechanism, it is unpleasant. It includes not only the sensation of discomfort but also emotional reactions to that sensation, such as fear, distress, and anxiety. Pain is associated with actual or potential tissue damage. An injury or surgical incision causes actual tissue damage. An example for potential tissue damage is when you touch a hot stove and you feel pain, but you immediately take out your hand before you get burned. Pain is highly subjective. It is influenced by various factors such as perception, emotions, and previous experiences. Pain can be classified as acute or chronic. Definitions of acute and chronic pain can vary. Acute pain is seen as a useful survival mechanism that serves a protective and healing function. Acute pain typically has a clear cause, such as an injury or surgery, and resolves as the underlying cause heals. Chronic pain is a pain that outcasts normal time of healing if associated with disease or injury. While pain typically serves an adaptive role, it can impact function as well as social and psychological well-being. I hope you are familiar with this diagram and pain pathway. Just to refresh your knowledge, just to refresh your knowledge. The pain pathway involves a sequence of events starting from the site of injury and ending in the brain where pain is perceived. Transduction is the initial stage where noxious stimulus such as a surgical incision activates nociceptive nerve endings. Inflammatory mediators released from tissue injury increase the sensitivity of these nerve endings. Transmission involves the electrical signals traveling along A delta fibers and C fibers to the spinal cord. These signals then enter the spinal cord through the dorsal roots. Modulation occurs in the spinal cord where the pain signals can be amplified or reduced by factors like endorphins and neurotransmitters. In the ascending pathway, pain signals travel through relay stations in the brain and thalamus before reaching the cerebral cortex. Perception is the stage where the brain interprets the signals, allowing us to consciously experience pain. Finally, in the response phase, the brain generates reactions such as reflex actions and emotional responses. The process is crucial for veterinary students to understand for effective pain management and treatment in clinical practice. Consider a dog that underwent amputation a few days ago but has not received any analgesics. This dog might be crying or panting, preferring low postures, and showing signs of distress such as flattened ears, limited movement, aggression, loss of appetite, and excessive licking of the surgical site. These behaviors indicate the dog is experiencing significant pain. Pain can lead to prolonged recovery and delayed healing of surgical site, potentially resulting in complications like suture dehiscence or infections. Additionally, the lack of effective pain management can hinder the animal-human bond and compromise animal welfare and veterinary ethics. Effective pain management is crucial to alleviate suffering, promote faster recovery, and enhance the overall well-being of the animal. Failure to adequately address acute pain may result in the development of chronic pain, which can be challenging to manage. How we can manage pain? To manage pain, we can use analgesics, which reduce the perception of pain or diminish the painful stimulus at its source. These medications work by interfering with pain signals with the nervous system. Analgesics are categorized based on their potential and mechanism of action. Here are some examples of types of analgesics and their target points on the pain pathway. Some analgesics act on multiple points within the pain pathway. What is multimodal analgesia? It is attempt to manage pain at different receptor sites by using variety of different drugs and techniques. In multimodal analgesia, we use more than 2 analgesic agents or techniques, and they should have different mechanisms, which lead to increased efficacy and reduced side effects. Why we need multimodal analgesia? Pain is a multifaceted sensation with various sources and types. No single analgesic can entirely block pain stimulus or address all pain types effectively. Each analgesic has limitations, making it necessary to use combination of drugs and techniques for comprehensive pain management. Benefits of multimodal analgesia. Multimodal analgesia targets various points along the pain pathway, providing comprehensive multi-level pain relief. This approach shortens recovery times, promotes wound healing, and reduces surgical complications. By tailoring protocols to species-specific and using lower doses of multiple drugs, it minimizes side effects and reliance on single analgesic agent. Effective pain management through multimodal analgesia also enhances overall animal welfare. And also, it reduces the frequency of top-ups while performing surgeries. Dog Star Protocol. As a successful sterilization program in Sri Lanka, Dog Star employs multimodal analgesia protocols to ensure comprehensive pain management by using the best available drugs and covering all points of the pain pathway. The program ensures effective analgesia for both canines and felines. For canine, the protocol includes lignocaine as local anesthetic, meloxicam as NSAID, xylazine as an alpha-2 agonist, ketamine as an NMDA antagonist, and buprenorphine as an opioid. The procedure involves administering xylazine and buprenorphine intramuscularly as pre-medication. Ketamine and midazolam are given intravenously for induction. During preparation, meloxicam is injected as preemptive analgesia. Lignocaine is used locally for both canine males and females before or during surgery to block pain signals at the surgical site. For feline sterilizations, Dog Star follows kidney cord protocol. In this protocol, medetomidine and alpha-2 agonist is used instead of xylazine. Lignocaine also used for local anesthesia. This comprehensive approach ensures that all points of the pain pathway are addressed, providing effective pain relief and improving the welfare of animals undergoing sterilization. Lignocaine blocks for males. At Dogstar, we highly value the use of lignocaine for its efficacy in pain management. Lignocaine is administered during pre-surgical preparation, specifically for incision blocks and testicular blocks in males. While administering lignocaine, the epididymis should be avoided and injection should be directed along the caudal pole of testicle. This local anesthetic works by blocking both transduction and transmission of pain signals during surgery. By inhibiting the initiation and propagation of nerve impulses at the surgical site, lignocaine ensures that animal experiences minimal discomfort, thereby improving the overall success and welfare outcomes of our sterilization procedures. In space surgeries, lignocaine is a crucial component for effective pain management. Initially, lignocaine is withdrawn into a sterile syringe and administered as a pre-surgical incision block. This local anesthetic provides significant analgesia by blocking nerve signals, transduction and transmission at the incision site. During the procedure, ovarian splash blocks are applied. The multimodal approach ensures comprehensive pain relief throughout the surgery. Despite its affordability and availability, lignocaine remains underutilized in small animal surgeries in Sri Lanka. By emphasizing its effective application, we aim to encourage its broader use in veterinary practice to enhance animal welfare. Misconceptions. Pain relief is dangerous. Pain control is a fundamental aspect of modern veterinary medicine. Effective management of pain is crucial for well-being and comfort of animals, particularly those suffering from acute or chronic conditions. The benefit of appropriate pain management generally outweighs the risks, provided that proper precautions are taken. The dog or cat is too sick for pain relief. Painkillers or analgesics can be used to relieve pain in sick animals, including dogs and cats. It is imperative that any use of pain relief medication is supervised by a veterinarian. Animals experiencing pain due to illness, injury, or medical conditions require tailored pain management to ensure their safety and comfort. Self-medication without veterinary guidance can lead to significant health risks. The dog or cat needs pain. The dog or cat needs to feel pain so they don't move. Pain serves a protective mechanism, limiting movements and activity to prevent further injury. While it's a natural response, managing pain effectively with veterinary guidance is crucial to avoid unnecessary suffering and promote optimal healing. I gave the dog some Panadol yesterday. One-time administration of analgesics may not be sufficient for ongoing pain relief. The efficacy and duration of pain relief depend on the type of medication used and its pharmacokinetics. Dosage intervals and medication choice should be determined by a veterinarian to ensure effective and safe treatment. Street animals don't need pain relief. All animals, regardless of their living conditions, are capable of experiencing pain. Street animals, like those in controlled environments, require appropriate care and pain management. Neglecting to address pain in these animals is inhumane and disregards their well-being. The dog or cat will get addicted. Contrary to misconceptions, animals, including dogs and cats, do not develop addiction to analgesics in the same way humans can. Drug addiction in animals is rare and typically involves specific and unusual circumstances. The focus should remain on effective pain management without undue concern over addiction. If you have any questions, please feel free to email us. Thank you for watching. I hope you found it helpful and informative.